How's it going, guys? My name is Steve Kuhn. I'm a physical therapist at Lincoln Surgical Hospital, and I do a lot of caregiver training for all of our patients with total knee replacements, total hip replacements, total shoulders. So I appreciate what you guys do. Without you guys, the risk of falling is much higher, and that would lead to fracturing a hip or a shoulder, which could then lead them into a nursing home. So I really appreciate what you do. Some of my background, I'm from Omaha originally. I went to Peru State College, played football for a couple of years, and then I got accepted into Creighton's physical therapy program and graduated with my doctorate of physical therapy. So today we're going to talk about the benefits of exercise, and then we're going to go through a few exercises that you guys can do at home while you're caregiving for your family and friends. So some of the benefits of exercise, regular physical activity can help keep your thinking, learning, and judgment skills sharp as you age. It can also help reduce the risk of depression and anxiety and help you sleep better. Both diet and physical activity play a critical role in maintaining a healthy weight, losing excess body weight, and or maintaining successful weight loss. Regular physical activity can also lower your blood pressure and improve your cholesterol levels. The American Heart Association recommends 150 minutes of exercise a week. So if you break that down, that's about 30 minutes 5 times a day, or 5 days out of the week. Being physically active also lowers the risk of developing several commonly occurring cancers, including bladder, breast, colon, esophagus, kidney, stomach, and lung cancer. Doing aerobic muscle strengthening and bone strengthening physical activity at a moderate intense level can slow the loss of bone density that comes with aging. Among older adults, physical activity also reduces the risk of falling and injuries from falls, so it's very important. 4 great exercises for caregivers include walking, strength training, cycling, and meditation or yoga. So walking or hiking is a great form of cardiovascular exercise that can be done inside, like on a treadmill, or at your local mall, or outside on a sidewalk or a walking trail. Strength training exercises focus on specific muscle groups to enhance muscle mass and endurance, which is especially helpful when daily responsibilities require physical strength. Cycling, caregivers can have the option of riding a bike indoors on like a recumbent bike or outdoors on a trail. While strengthening the legs and hips, cycling also benefits the cardiovascular system. The last one, meditation and yoga, providing care often becomes stressful for a variety of reasons. So you got to make sure to take the time to rest and alleviate stress by practicing meditation or like a beginner's yoga program. So how much cardio do I need? So cardio is an aerobic activity, which means it's getting your heart rate up and helping circulation. So each week, they recommend 150 minutes of medium intensity cardio, like brisk walking. Okay, you can split that into 30 minutes 5 times a week, or you can do 75 minutes, 1 hour and 15 minutes of high intensity cardio, like swimming, cycling, and/or running. Or you can do a mix of both, a little bit of walking, a little bit of jogging, and kind of mix it up, okay? Break it down. So you don't have to do it all at once. If 30 minutes is too much for one time, break it down into 3 times a day for 10 minutes. You just got to make sure to really work that 10 minutes. If it still sounds like too much, aim to get 30 minutes for 3 times a week, and then kind of work your way up to 5 times a week. So before you start an exercise program, I do recommend to get clearance from your doctor at your local primary care physician's office. everyone is on a different exercise journey, whether you're a beginner or advanced and you're the weekend warrior. If you have any underlying conditions, please ask your doctor before you start an exercise program. So, exercise equipment for home. So since you're caregiving, you don't have the opportunity to go to a local gym and don't have that time. So what you got to do is bring the gym into your home. So some good resources, treadmills, recumbent bikes, ellipticals. For a more affordable option, there's a lot of used equipment on like buy, sell, and trade sites, thrift stores, stuff like that. You can also get a pair of dumbbells. You can use TheraBand or like resistant bands. You can use ankle weights. You can get a yoga mat. If you don't have dumbbells and you can't afford dumbbells, just get a soup can. The smaller soup cans equal about 1 pound. The larger soup cans equal about 2 pounds. So that's kind of a way to advance the weight. You can also use your stairs at the house or like a chair to help support you during the exercises. So just try to use some of the stuff in your house for equipment. So we're going to go through a few upper body strengthening exercises, and then we're going to go through a few lower body strengthening exercises. So the first one is called shoulder flexion. Okay, so that's just raising your arm up and then back down. Now, if that's pretty easy for you, you can get a 1 pound weight or you can get a resistant band. So I have some 2 pound dumbbells right here. Since it's pretty easy for me, I'm just going to raise it up, hold for about 3 seconds, and then slowly lower it back down. I recommend doing it 10 times, hold for 3 seconds, and you can do that 3 times a day. Okay, now if that's painful, you might have to modify it. Don't use any weight and just work on the range of motion. If it's too easy for you, you can bump up the pounds and dumbbells, or you can get a resistant band like TheraBand, and you can either hold it like this and then kind of go up like that, or you can put it down and step on it and kind of go up like that. Okay, that is shoulder flexion. Then you have shoulder abduction. Okay, so you keep your thumb up, go out to the side, hold for 3 seconds, 1, 2, 3, slowly lower it back down. Again, if that's pretty easy, you can get a dumbbell, start with 1 pound, slowly work your way up. Again, nice, slow, and controlled. Okay, and again, if you're using TheraBand, you can go out to the side like that. Or again, you can step on it, out to the side like that. These are really good shoulder exercises. Okay, so again, hold for 3 seconds. You would do it 10 times, 3 sets a day. All right, so the next exercise is called wall push-ups. So the wall push-up is a modified push-up. So this is like the first step of a push-up. Okay, so if a regular push-up is too difficult for you, I recommend you starting with the wall push-up. You're going to go about shoulder width apart. You're going to just bend your elbows. You do that 10 times. Hold for 3 seconds. 1, 2, 3, and relax. If that's pretty easy for you, you can step back a foot. Okay. If that's pretty easy for you, you can kind of progress to like a table push-up, which is a little bit lower, which is going to increase some of the resistance. So basically, table surface and down. Okay. The next progression would be down to the floor on like your yoga mat. You'd go from your knees to your hands, keeping your hands about shoulder width apart. Again, keep your back nice and flat, nice and straight, and then down. Again, 10 times, hold for 3 seconds, 3 times a day. All right, so the next one is called scapular retraction. So I'll kind of show you guys. So basically, you're kind of squeezing your shoulder blades together, holding for about 3 seconds. 1, 2, 3, and relax. And again, 1, 2, 3, and relax. This is a good exercise to improve your posture. And a lot of times, we're kind of slouched forward. This kind of opens up our chest and kind of gets us back into that good neutral posture, okay? If doing it without resistance is too easy, you can use a TheraBand, okay? I'm starting with yellow because yellow is the easiest. Basically, you put it in the door, and then you're just gonna pull back. Again, kind of squeeze your shoulder blades. 1, 2, 3, and then relax. And then again, 1, 2, 3, and then relax. If yellow is too easy, you can progress to red. If red is too easy, you can then progress to green. And if green's too easy, you progress to blue. So those are the different resistance levels of the TheraBand. So again, you do that 10 times, hold for 3 seconds, 3 times a day. Okay, the next one is called a bicep curl. Okay, so all you're doing is just bending your elbow, hold for 3 seconds, and slowly lowering it down. You can do both at the same time if you want to. Okay, if doing it without weight is easy, bump up to a pound dumbbell. If 1 pound is too easy, bump up to 2. Slowly kind of progress yourself. Okay, so again, palms open. Hold for 3 seconds, 1, 2, 3, slowly lower it down. I see people all the time, they just want to rush through it like this. Take your time, slow and controlled is better. If you only have TheraBands, and you can hold this, put it down here, and then go up, just like that. Or you can put it down on the ground. And nice upright posture. Do 10 on both sides. Hold for 3 seconds, 3 times a day. Okay? So that is the upper body exercises. Okay? So next we're going to go through a few lower body exercises. Okay? So for the lower body, I would recommend getting either some ankle weights. You can go to Walmart, for 10 or 15 bucks, you can get a set of like 1 to 5 pound ankle weights. It's pretty reasonable. So the first one is called the standing march. Okay, that you're working your hip flexors here. So if you have a chair, for example, you can kind of hold on to the chair, hold on to your kitchen counter, and basically you're just kind of lifting up your knee. 1, 2, 3, 4, 5. You do that 10 times. If you don't feel comfortable with doing it without any support, like I said, hold on to a chair, put it next to you. 1, 2, 3, 4, 5. You would go to 10. And then you would switch. Do it on both legs, okay? So, like I said, to progress that, you would put the ankle weights around your ankles. Start with 1 pound, and again, just kind of go up. Have a good posture. Don't lean forward. Stand nice and tall, and then just kind of raise your knee, just like you're marching. Okay? So again, that's 10 times, hold for 3 seconds, perform 3 times a day. The next one is called a standing hamstring curl. So that's where you're standing and you're holding yourself onto a counter for support or a chair or a table, and then you're just bending your knee. So you're doing a hamstring curl, hold for 3 seconds, 1, 2, 3, and then slowly lower it back down. Again, 1, 2, 3, 1, 2, 3. You do that 10 times, and then you would switch. 1, 2, 3. 1, 2, 3. 1, 2, 3. That is a good hamstring strengthening exercise. Again, if doing it without resistance is too easy, bump yourself up to a pound ankle weight and then slowly kind of progress as you can tolerate it. If that's painful for some reason, just stop. Or don't use any resistance. Okay, the next one is called standing hip abduction. So I'm going to come over here. So basically what this is you're kind of bringing your leg out to the side. Okay, this is a great hip strengthening exercise. I recommend this quite a bit actually in the outpatient physical therapy world. So you're going to hold on to like a counter, table, or a chair, and then you're just going to lift your leg up, hold for a couple seconds, then slowly lower it back down. And again, 1, 2, 3. A lot of times people like to turn their leg out to the side because it's easier, but then you're just working your hip flexor. You want to focus on the muscles back in your hips. So you're going out to the side, keeping your toes pointed straight ahead, and then back down. Okay, you would do that 10 times, and then you would switch. Again, you could use ankle weights to kind of add or increase resistance. Or there's TheraBands you could tie around your legs and then kind of go out to the side, which would increase your resistance also. Okay? So that is standing hip abduction. So again, 10 times each leg, hold for 3 seconds, do that 3 times a day. Okay, the next one is called calf raises. All right, so again, you're holding on to something, so you're nice and stable, and then you're just going up on your tiptoes, hold for 3 seconds, 1, 2, 3, and then relax. 1, 2, 3, and then relax. 1, 2, 3, and relax. 1, 2, 3. You do that 10 times. Hold for 3 seconds, 3 times a day. Okay? And the last one is called seated knee extension. So you're sitting, okay? And you're just straightening your leg from that seated position. This is a good thigh strengthening exercise. You're going to strengthen your quads. Okay? Hold that for 3 seconds. 1, 2, 3. Then back down. 1, 2, 3. And back down. Again, if that's too easy for you, put a pound ankle weight on, and then slowly kind of progress the weight. If you have any knee pain with that, then just stop. Okay, you do 10 on each leg, so we'll switch. Again, hold for 3 seconds. You do that 10 times, hold for 3 seconds, 3 times a day. Some advice on that one, make sure you're all the way back in the chair. If you're on the edge, it's gonna feel weak. It's gonna, that could increase some hamstring tightness for you. So you wanna make sure you go all the way back, nice supported on the chair, and then straighten that leg. They'll feel more comfortable. All right, so I said this a couple times earlier, but if any of the exercises causes you pain, just stop. These exercises are not meant to aggravate you, and if they do, you may need to modify the exercises or just stop them completely. If you have any immediate questions or issues, please contact your doctor. Your doctor may refer you to outpatient physical therapy to address the mobility barrier, to evaluate a painful joint, assess your balance, in order to progress your exercise program to improve your overall strength and activity tolerance. If the exercises are easy for you, like I said earlier, you may benefit from an advanced exercise program where you slowly kind of increase the weight and the resistance. So if I know we did 3 sets of 10. If 3 sets is too much, start with 1 set of 10. Build your way up to 2 sets of 10, and then go to 3 sets of 10. So appreciate you guys' time today. Thank you very much, and take care.